The Center for Disease Control is monitoring an uptick in early flu infections in some areas of the southern U.S., and it could be an indication that we're in store for a more severe flu season. So let's bring in CBS News medical contributor Dr. David Aegis to talk a little bit more about this and, of course, to answer some of your other questions.
Right. So, Dr. Aegis, before we turn to the questions from the public, I want to ask you, what is your level of concern as we move in? We're actually sort of already in flu season.
It's significant. Australia, which is kind of the bellwether for our flu, had a earlier and more aggressive flu season than average. In the United States, we haven't been exposed to the flu in a couple of years, so our immunity is very low. You couple those two things together, normally I'd say mid to end of October, get your flu shot. Now I say get it right now. And it's very important, if you're older, either get the high dose or get a second dose in January so you can keep immunity through the flu season.
So let's talk about some of the other viruses that were sort of top of mind like 5 minutes ago and we sort of stopped talking about. Monkeypox. The CDC released a report that monkeypox could spread indefinitely in the United States. Do you think that we missed the window to eradicate it?
Yeah, Anne-Marie, we certainly did. So we're doing better now. Vaccines are out there. Immunity is up in the at-risk population, and we're seeing significantly fewer cases. That being said, there's enough spread in enough places in the country that it's not going to be totally eradicated. It'll be at a very low level, but we have a treatment for it. And again, we have a vaccine that will prevent serious complications from monkeypox, so we need to get it. So I think we're in a much better situation, but we kind of missed the window to close it off totally.
So let's go to questions from the public. Dr. Aegis, about a different vaccine, the new COVID booster. A doctor told us that the new booster for COVID has had more serious side effects that make it risky. Is that true?
Well, we know now 3.9 million people in the database. There have yet to be serious side effects. So that answer is no, it is not true. And I think there's a lot of mis and disinformation about this new COVID bivalent booster, both from Pfizer and Moderna. They are remarkably well tolerated and they work. They give us broadened immunity, which we need to prevent serious illness and hospitalization. So hopefully both of you got yours. It is very important.
So this next question is actually on a topic that we've touched on before, but clearly people still want clarification. So the writer says, I have gotten all of my doses, including my first booster from Moderna. I've read that there is a greater protective effect to get the second booster from a different manufacturer. Is there any data about this?
Anne-Marie, you always go to the data, and that's the good thing about you, and I like that. So the data show is that when you do switch, if you've been all Pfizer or all Moderna, you get about a 15 to 20% boost in your antibody response at that switch. And I've said all along, stick to one, and when you go to this new booster, when we really need a broad immune response, a bigger one, switch. So I got all Pfizer. Remember, healthcare professionals, Pfizer was out first. We all got that. And then I switched to Moderna for this new bivalent booster.
All right. Here's another one. Is it too early to know the efficacy regarding young kids and the new bivalent booster?
Bivalent.
Bivalent.
Is it Latin?
It means there are two parts to it, BA4 and BA5. And so the current bivalent booster is approved for 12 and older. There was data from a trial that's ongoing in kids age 5 to 11, and they look excellent. My gut is over the next several weeks, we will expand the eligibility for this booster to children 5 to 11 because the data look great.
All right, Dr. Aegis, I'm going to say bivalent to you. Like how I did that?
What is in your coffee?
I don't get pronos. Nothing's happening today. Always great to have you, Dr. Aegis. We'll see you next week. If you have more medical questions, you can send them to Dr. Aegis. You can tweet him at David Aegis, or you can text him at 310-299-9322. Of course, we're going to have Dr. Aegis on the stream every Thursday morning, and he might even answer your questions.